Tamika, I'd like to look in on your patient that's receiving intravenous antibiotics.
Okay, sure.
What will you be doing?
I'm going to be administering my patient's antibiotic with a mini infusion pump. That's also known as a syringe pump, right?
Right. And what will that entail?
That means the pharmacy mixed the medication in a syringe. So I'll be inserting the syringe into the pump, which is connected to the primary infusion tubing. And the pump delivers the medication using a mechanical pressure applied to the syringe plunger.
You seem pretty comfortable with the procedure. Ready to administer?
Are you sure you don't want to?
What is it with you guys in this? You're so confident in the information, but you...
It's just, it seems so complicated sometimes with the syringes and the adapters and... sometimes it feels like I can't fit anything else into my head.
Just relax. It takes some time to feel confident in everything. But you're very bright, Tamika, and I have a lot of faith in you. I'm here to help, okay?
Thank you. That's very reassuring. Okay.
All right,
let's do this. First, I check the medication order against the original order. Check for allergies and any inconsistencies. Observing the 3 checks and 5 rights. Then gather my equipment.
Okay.
The MAR, the mini pump infusion tubing, alcohol swabs, and tape. The syringe pump is in his room, right?
Keep going. You're doing fine.
Okay. So I read the MAR and retrieve the patient's medication from the patient's drawer and compare the label on the medication with the MAR. That's check 2.
Mm-hmm.
I'm going to infuse it over 30 minutes, which is the prescribed infusion time. Compare the information one last time. And that's check 3. Then we're off to see the patient.
Here we go. Good job.
Okay.
There we go.
Good morning, Mr. Nixon. How are you? This is Miss Swenson, my instructor. She'll be observing, okay?
Pleasure.
Now, I have an antibiotic for you. Would you mind if I administer it now?
No time like the present, I say.
Okay. I'd like to check your ID band and compare it to the MAR chart. What's your name, please?
My name is Robert Nixon.
Excellent.
Did you check to see if the antibiotic is compatible with the primary IV solution?
Yes, I already checked, and it's compatible. So, Mr. Nixon, I'm just going to check your IV site for inflammation and infiltration, and it looks fine. So, we're ready to get started. So, I'm going to check the syringe for air bubbles, and I don't see any. But if I did, I would expel the bubbles from the syringe. Next, I attach the syringe to the mini infusion tubing.
Nicely done.
And fill the tubing with medication solution by firmly pressing against the syringe plunger.
There you go.
Now, I'm inserting the syringe into the mini infusion pump with the flange of the syringe in the clamp's groove.
Now use an alcohol swab to clean the medication administration port on the primary infusion tubing closest to the patient and connect the mini infusion tubing.
With that done, I program the pump to the correct rate, in this case over half an hour, and press start.
You should assess Mr. Nixon and the pump about 5 to 10 minutes after the infusion starts to make
Okay.
sure everything's working properly.
Okay, cool. We'll have a nice chat.
All right, I'll leave you to it. Looks like things are under control. Thank you.
How are you, Mr. Nixon?
Great.
Hi. Now that the infusion is complete, you can press the off button on the pump,
Okay.
disconnect, and properly discard the tubing.
Okay. Next, I'll recheck the primary infusion and document the medication administration.
Very good, Tamika.
Everything okay, Mr. Nixon?
Great.
Great. We're all set. I'll check back with you in a bit, okay?
Thank you.
Thank you.
Let me grab that and we'll take that with us and discard.